Hey, so my name's Paul Morgan. I was a client at Olympic from the end of July 2022 to the middle of October 2022. A little bit of background on me to let you know kind of how I ended up here and what sort of stuff Olympic did for me. So I grew up in Washington State, in Western Washington. I had a relatively normal childhood, both parents, grandparents, stuff like that. Around 14 years old, when I was getting into eighth grade, I got my first kidney stone, and getting that first kidney stone started me along an 18-year nonstop on-demand prescription for things like morphine, Dilaudid, Percocet, Vicodin, fentanyl, whatever was going on at the time in terms of like pain management. I had pretty much nonstop access to for 18 years. So I had through that a relatively normal childhood, a relatively normal high school, a pretty standard, as I understand it, college experience. After college, I went to work for a couple of my dream companies. I had a business of my own. I lived in Los Angeles, and then after Los Angeles didn't seem like it was working out, I moved back in with my parents at the age of 27. When I was 27, I got a job at a restaurant in Western Washington and noticed pretty quickly, oh, the way to hang out with my coworkers was to drink after work. So got in the habit of drinking almost every day after work, kind of like stopping my pain medicine use at a certain hour so that it would be okay for me to drink, and in doing that, I developed this kind of understanding that drinking was a great way to hide from your problems and have an excuse for being not on your best behavior. I got to drinking a lot and taking pain medicine a lot. And after a few years of that, I got a way better job with way better insurance. That way better insurance got me access to more pain medicine, but also I was making more money. So I was drinking more often as well. And, you know, things started kind of falling apart. I didn't hurt anyone, luckily. I didn't steal anything, luckily, but I was losing my mind. And after a couple years where I was drinking definitely every day and taking pain medicine every single day, there was a point where for a couple weeks I was drinking from the moment I woke up until the moment I passed out at night. And after that couple of weeks, I said to myself, I am totally done. I have this fancy insurance. Why don't I call them and ask them if they could send me to some sort of rehabilitation facility? So they sent me down here to Florida to a detox facility. I stayed there for 20 days, after which I transferred to Olympic here. And once I was at Olympic, having had 20 days of kind of the foundational work behind addiction recovery and coping skills and stuff like that, my whole world opened up. I had a wonderful therapist who taught me the importance of looking back into my past and finding what maladaptive coping mechanisms I had picked up as a child and trying to undo those. I had a wonderful trauma therapist who, I going into Olympic, I was pretty convinced, I've never had any trauma in my life. I had a normal life. And then we got to talking about my past, and, he said a lot of things that you mentioned qualify pretty acutely as trauma. So I went through trauma therapy as well, and I found out how to deal with things in my past that weren't, working for me. I kind of developed a lot of habits before I had come down to Florida that were not serving me. I developed a lot of beliefs that before I came down to Florida were not serving me, and being at Olympic helped me undo a lot of that. So, through my therapist and my trauma therapist and the rest of the clinical staff, I developed this new way of looking at things. I developed a stop overthinking about things and just do them kind of attitude. And that has served me greatly in my time since coming to Olympic. I've also gotten to this place where through working the steps of my 12-step program. I don't fight against the things that I can't control. I go through and I see what's happening that's good and what's happening that's bad. And, acceptance is kind of the key when it comes to that. Another kind of thing that Olympic instilled in me is the make it work mindset. So, when I first got to Olympic, I met someone who had visited me in my detox center, and they said, if you want to go to meetings, to 12-step meetings while you're here, when you're not on property restriction or something like that, you should go to as many of them as you can find your way to. Find rides, borrow a bike, take an Uber if you have the financial ability to. And I took that to heart, and it really changed the way that I view my level of capability as far as it concerns being out in the world on my own. I always kind of thought like, I'm a victim of the world. Whatever the world does is kind of my, I have to just put up with it. Whereas now, I feel as if I have this uncanny ability to make my life happen and figure out what I want and find a way to go get it for myself. So Olympic was a huge influence in terms of my current attitudes, my current behaviors, and things that I've picked up along the way that have improved my life. One of my mentors says, what good is a belief if the belief doesn't serve you? And I've really taken that to heart because of my time at Olympic, and I've developed, attitudes and beliefs that serve me in my daily life, but also make my life a better place in a tangible way. So Olympic was a huge turning point in my life. I was 32 when I got to Olympic, and I had never considered the possibilities of being my highest self. I've always kind of aspired to things. I thought, oh, you can do this, you can do that, you can believe this, you can believe that, but it's all kind of moot because when it comes down to it, you're not going to achieve any of that. And since coming to Olympic, I have rapidly achieved more of my dreams now than I did in the 8 to 10 years I was grinding away in LA at some of my dream jobs with some of my dream companies. So, Olympic had a profound effect on my ability to live my life and to be the person that I always thought maybe I might be capable of being. So one thing that really blew me away about Olympic, that having worked briefly in treatment, I know that a lot of other treatment centers aren't doing, is their emphasis on the holistic approach to addiction recovery. So if you go to your average treatment center, what they're going to do is they're going to put you in a bunch of classes where speakers or teachers explain the 12 steps to you of Narcotics Anonymous or Alcoholics Anonymous or Cocaine Anonymous or any of those other things. What Olympic did was they combined that with other things that I know now to be vitally important to addiction recovery. So things like nutrition, things like holistic health, an example of which would be acupuncture or yoga, which we did on a weekly basis. And approaching addiction treatment from a moral or philosophical perspective, as they do at other treatment centers, might work really well for someone, but the fact of the matter is addiction is both a mental and emotional and a biological disease. It's not just one of those things. So yes, you might resonate with some people by focusing on the 12 steps of your average 12-step program. However, if you are not feeding your body nutritious food, your brain can't recover enough to get you through that first bit of being without your drug of choice. If you are not exercising, your body cannot recover in a quick manner from using your drug of choice. If you are not figuring out your path to spirituality, whether that be religious or non-religious, then you don't know what to look for in terms of serendipity and coincidence and how to treat those things in your life. And Olympic had a good mix of all of those things. They had group facilitators or teachers who would do the nutrition, some who would do acupuncture and yoga. And through just getting your body moving, through knowing what to feed yourself and what not to feed yourself, you can start to repair the body, and the body necessarily improves the function of the mind if it's functioning properly. So, like I said, I worked in treatment for a couple months, almost a year after I got out of Olympic. And I noticed that treatment center that I worked at, it was nonstop sugar snacks, no schedule except for groups and leisure activities, and all their groups were focused on the 12 steps. They didn't go through coping skills like Olympic did. They didn't do art therapy like Olympic did. They didn't approach addiction recovery from a holistic standpoint, which is what I now believe to be the driving factor behind the strength of my recovery. I have a strong recovery because learning about nutrition at Olympic got me to seek out nutritional experts from all over the world, and I found a nutritional model that worked to literally repair my body from the damage I had done to it by taking drugs and drinking for so long. Same thing goes with movement. Learning about Olympic having given us the opportunity to go to the gym got my body moving, and when I got used to my body moving on a more regular basis, I became more metabolically healthy. When I learned the basic principles behind acupuncture and yoga, I started learning that, the breath is very important as opposed to just existing when you're not doing anything. So there's this holistic approach that Olympic has that's tough to describe without sounding like I'm, some sort of hippie or something like that. But it does affect you in a deeper way than just going through the mental part of addiction recovery, because let's be honest, not everyone is going to respond to just the mental part of addiction recovery. The theory is good, but the practice is so much deeper than a lot of the theory.